Okay, we're going to start some training on therapy. I want to go through a few principles first. First of all, I want to introduce Leah, who's going to be our model. So Leah, you can go ahead and sit on the table right there. I wanted to talk about a couple of things on therapy that are principles that are important to remember. First of all, we want to remember that for patients, we want no surprises. When patients first come into the office and they're going to walk through the front door, there's going to be a hesitancy on anyone who goes into a new environment to open that door and walk in. They don't know what to expect of who's going to be at the front, how many people are going to be in the waiting room, are they going to know anybody there, what should they do when they go in, and so there's a tiny little bit of hesitancy on a person's part. Once they come in, if we greet them, say hello to them, tell them what to do, gives them some instructions, they're going to be much more comfortable. The same thing is true when we bring them back from the front area back into the therapy or treatment area. We want to call them by name and have them follow us. Then we want to walk back with them and not have them trail back behind us and they're trying to figure out if they're supposed to follow us or what they're supposed to do. If we walk by them and make conversation with them and accompany them, it'll be much better than us taking off and leaving them in the dust, so to speak. When we go to a room and we take the patient into a room, we also want to give them instruction of what to do. Another thing that's important with patients is not only to have no surprises, but it's also when they come in, our desire is for them to have to minimize their decisions. When they come here, they want to be taken care of. And one of the ways that we help to take care of them is not to consistently give them more decisions and more decisions to make. So have in your mind ahead of time, how do you want them to be when they get into the room? Instead of going in the room and saying, would you like to sit or lay down? Do you want to lay on your back or on your stomach? Do you want a hot pack or do you not want a hot pack? You've already inundated them with decisions that really they don't know what's best and they have to stop and think, what do they want? Instead of that, you already know if they need a hot pack because it's been written on the travel card. This isn't McDonald's, so we're not up in the air saying, do you feel like a hot pack today? That's not what we base that on. If you want to know if we should change them needing a hot pack, then buzz the doctor and ask him, but don't ask the patient. Secondly, when you take them into the room, we sometimes are faced with having them make the decision of whether they want to sit or they want to lay down. I will tell you now, my preference is to have the patient lay down. Why? Because they're going to be more relaxed. My preference also is that you stop and think of what their problem is. You'll know what their problem is because you know the area that we're doing treatment on, perhaps therapy or where we're putting the hot packs or the areas that we're adjusting. If they have a low back problem, we generally don't want them to lay on their stomach because until they get quite a bit better, laying on their stomach is going to become uncomfortable and they'll have difficulty getting up. That's true for waiting in the treatment room. It's also true for being in the therapy room. The second thing is that we want them to not lay on their stomach face down if they to have therapies if they're going to have severe back problem, and if so, we need to put a pillow under their hips so that they have an arching in the back and their back is like this rather than have it flat and they get somewhat of a bowed position. So that's a second thing to remember. If they do need to lay on their stomach and they have a back and neck problem, we want to make sure that we support their low back some so that they don't have the hyperextension or arching of the back that can cause them pain. Generally, they're going to be better off to lay on their back or to lay on their sides. When they lay on their back, it's going to be best if they have their knees bent rather than straight. Now, they may be more comfortable having them straight, but what I would do if I was taking them in a room is I would say, we're going to bring you in the room here. We would like you to lay on your back, make yourself comfortable. I'll set the pillow comfortable for you. My suggestion is that you have your knees bent. If you prefer, you can have them straight. Or while you're waiting for the doctor, you can change the positions. And that at least gives them an option to do. If they lay on their stomach, we want to make sure and double the pillow up under their shoulder so that their head is properly supported. Another thing to remember is that when they are on their back, we want to try and double the pillow and put it under their shoulders and head rather than simply have it under the head so that their head becomes arched upwards like this or flexed upwards. We would rather have it supported under this region here and the neck so that they're more comfortable. If they're supposed to put on hot packs, we want to remember the importance of having the hot packs in a position that's going to be comfortable. For example, if they have a low back problem, it's generally going to be better to hot pack them with them on their sides and put a support around them. If they have a hot pack under their back and lay there for a while as their muscles relax and they're acute, or in other words a relatively fresh new patient, they'll have difficulty getting the hot pack off them to lift up so we can take it out, or difficulty being able to get up off the table. The same may be true if they have a hot pack under their shoulder blades and they have a mid-back problem. We may, in that case, want to have them lay on their stomach or have the hot pack across their face. If they have a problem in their shoulder blades or their neck, it is going to be best to have them on their back for their therapy. That's because the pads will stay in position better and won't tend to slide as much. If it is on their low back or in the mid-back area below the shoulder blades, and perhaps on women it would be the bra line area or below, then it's usually working better when we have them lay on their stomach, pillow under their hips, and they'll be able to be solid on their therapies there. If we do therapy on the gluteal region, it is generally going to be more effective to have them lay on their side with that side up, strap a hot pack over that buttocks area with the pads on that gluteal area, and it'll hold in position better. Sometimes you can do it when they're laying on their stomach, but you have to make sure that you get a hot pack or weights on there so it holds the electric current pads in position. If you're using microcurrent, of course, it won't be as challenging. Okay, the final thing that I wanted to mention to you is that when we do the therapies, and we're going to take the patient from the treatment room to the therapy room, or vice versa, we also want to have them follow us, walk with them back to the therapy room. When you get in the therapy room, then give them instructions of what to do. Generally, if they're going to lay on their stomach, I prefer to have you move the therapy table out slightly so that they have room to fit their arm down when they're laying there on their stomach. It's easier for them. They don't have their arms along their side, and sometimes that will be uncomfortable. If they feel more comfortable with their arms along their side, that'll be fine, but they won't be forced to do so. So generally, you'll want to make sure that the therapy table is moved out sufficiently from the wall, and that will only need to be maybe 4 or 5 inches. Okay, finally, the other thing that I would mention to you is when you're going to do hot pack therapy, make sure that you have the therapy wrapped in the area around the neck the way that we would want that, and that is that you put the hot pack back underneath the neck enough that it reaches across the trapezius ridge area and then goes around their neck. Usually they'll be able to have that curl around the neck enough to keep them warm. If you have pads there, you may need to put a strap on to hold it in place so that the pads get adequate contact, because remember, when electric current is used, if we do not keep the pads up against them tight enough, it will tend to pinch them or give them somewhat of a spark that will be uncomfortable for them. I'm going to go through now the nurse call part. Remember, I mentioned that we don't want surprises. One of the things to remember, when we leave the patient, we always want to make sure that they know what to expect as we're doing therapy on them. They know what we're wanting to sense from them, and they also know what to do if there's a problem. So for example, if I was going to do ultrasound on a patient, I would tell the patient that I'm going to do some ultrasound on them, and if they don't understand the purpose of the ultrasound, I would explain that it is a sound wave frequency that penetrates through the skin and into the tissues about 1 inch or 1.5 inches and causes a cellular vibration, much like if you dropped a rock in the pond and you would see ripples go out from that rock. The same thing happens from the sound head as it directs the sound waves into our body. The piezo or piezo, either way it's pronounced, electric current will cause that sound wave to form and will create that in a downward fashion from the sound head. We use the gel to try and seal that sound wave so that it gets directed into the tissue. I would then tell them, I explain that by the way more thoroughly than you'll need to, but basically you could say to them that this is a sound wave that's directed into the tissue because it will cause a cellular vibration that will help to break up inflammation and tissue adhesions or scar tissue that forms from injuries, and also will help break up muscle spasm. Now, when you do the therapy, the thing that I would tell the person is to let you know that I would mention to them that they may not necessarily feel heat. But if it does start to warm up, we want to know that. And the reason we want to know that is because if it starts to get warm, then we're going to know that we want to tell them the next thing is, when they say that's starting to get warm, I'm feeling heat, the next thing to point out to them is, I would like you to let me know if it gets too hot or uncomfortable. It shouldn't, but if it does, tell me. Why is that? Because if it gets hot, then they might have a chance to get an ultrasound burn. The other thing that we want to mention to them is that when we leave, is to let them know when they're on a therapy that if they need help, if they feel uncomfortable for any reason or have a concern, to push the nurse call button. We always want them to feel protected or safe, and let them know that if they do that, we'll immediately come in and assist them. And then we give it to them in their hand. That's whether on electric current, microcurrent, or on traction, they have that access to it, to the nurse call button. Okay. Now we'll go ahead and go through some specific therapies, and I'll tell you some of the basic principles to use when we're going to do the therapy. I've already mentioned to you that when we take the bottom of the shoulder blades and go downward, that we'll tend to have the patient on their stomach, unless they have a bad low back problem, in which case they'll tend to be on their side. If it's the bottom of the shoulder blades upward, we'll tend to have them on their back for therapies that are going to be positional and that we leave them with, unless there's some other reason and we say have them on their side. When you do the therapies in the upper area, you'll just simply have to have them roll up to the side so that you can fit the pads in position. Also, if you're going to do an ultrasound on a patient, it doesn't matter if they lay on their stomach or lay on their side. You just have to have access to the area. We want them to be comfortable, and that's the important thing. And so take that into consideration on the patient. Ask them if they're comfortable. If there's anything concerning them, answer those things, and then you can leave. Okay, we're going to first start out with microcurrents. So I'm going to have Leah lay here on her stomach. I'm going to put this one on her low back. So I'm going to have her lay on her stomach. You'll notice I have the pillow there. The pillow could be flat, or if there's some reason that they're too hyperextended on the pelvis here, I'm going to move this camera. If they're too arched in the back right here, then we may want to double the pillow and put it under the hips, and in that case we would do this. I would fold the pillow in half, I would set it so that the open end goes upward, and then have her lay her back over there, her pelvis over this, and lay down. Now Leah, you tell me, is that more comfortable or is it more comfortable flat?
It's more comfortable.
Okay. The reason is because she doesn't have as much of a curve. Now other people may not be as comfortable with this. You'll have to get to know each patient. Now the other thing we'll notice, raise up. If I have this pillow up high like this, now lay on it. Do you know how comfortable is that? Do you like it better the other way or this way?
The other way.
Okay, that's because it puts a lot of pressure here on her. Also, if you get it down here too far, now do you see how that doesn't give you support?
Mm-hmm.
So the thing we want to do is get her supported under the waistline here so that when she lays there it takes that arch out. Is that comfortable?
Yeah.
So that's the thing to remember on the pillow positioning. Now lift up. If we do this arching, she can lay in the middle on that, but again you want to make sure that they get some support. Depending upon the amount of curve they have here, and if they tend to be thinner, they'll do better with a doubled pillow. If they tend to be heavier, or they don't sway here very much, then they'll tend to do better with a single pillow. Now when we do the ultrasound on her, because of modesty issues, I'm not going to lift up the back or have her put a gown on, but I'll go through the same principles. First of all, when we take the ultrasound gel, you will have taken it out of the crock pot. When you do that, you want to make sure that you feel by the tip of putting a tiny bit of gel on your finger, how hot it is. We don't want to burn the patient. Sometimes sitting in there, it can get quite warm. It will cool off very rapidly though once the gel is on the tissue. You may have to put it on your hand first and then wipe it on the patient if it's too warm, and that'll be an easy way to do it. Sometimes people wonder how much ultrasound gel to put on. I generally would say to put on the size of about a quarter. And if you do that, that will be a good amount to get you started. Then before you turn the machine on, I would spread that just a little bit, let the patient know it's going to be cold if it's not warm yet, or if it's warm you want to let them know that it is hot, And as you do that, it will allow you the chance to warn them, because you want to gain the patient's confidence that you will not pull surprises on them. Then once you do that, you will tell them, I'm going to move this sound head around, and as you do that, the patient will understand what's going to take place because you've warned them. Then you tell them, if this gets warm, let me know. It may not, it doesn't matter if it does, but I want to know if you start to feel warm. If they say they start to feel warmth, then the next thing you'll tell them is, if it gets too warm, let me know if it's in any way uncomfortable. And then you'll do this ultrasound. Now when you do the ultrasound, as you work with the sound head, you don't want to cross over the bone.
Hi.
You want to make sure that doing the ultrasound that you stay on one side, and then if you need to cross, you do so quickly, but don't stay on the bone. It's meant to go over the muscle tissue itself on either side of the spine. Sometimes people will wonder how much pressure to use. In using pressure on this, I would do an analogy that if I were to put it on my hand, too light a pressure would be that I see no whitening on my skin. If I pressed on it, you would start to see a little white image around the side that would show you that you were putting an amount of pressure on that's going to cause you the right amount of force in the ultrasound. So to get a practice on this, I would take my finger and push it into my hand. When you start to feel whitening around the finger, that's going to be about the same amount of pressure that you should use with the ultrasound. Then the stroke of the ultrasound is going to be either a vertical up and down, or you can do a circular pattern, but you want to be careful not to stay on one area too long. If you stay on one area too long, you will find that you'll get an ultrasound burn. Now that's not truly a burn like if you had a match on somebody. What happens is that the sound waves cause the frictional vibration too much on one spot, and that causes an immediate heat. When you get that immediate heat, it will cause a deep internal type of pain and a burning sensation or sharp sensation that goes up through the muscle tissue. When that happens, the patient will, within about a second or 2 seconds, panic because the pain becomes intense. If you start to have the patient in any way do that, simply take the ultrasound off, put it on your hand, move it on your hand, and they'll know that immediately, just as fast as that came on, it will go away. And let them know that it was just a heat factor that came on from the ultrasound because of the sensitive tissue there, and you'll simply need to move it further, move it more quickly. The hint that you'll get is when you start to feel the patient say that's getting a little bit warm after you've asked them to let you know if it gets too warm. The other thing is if you start to feel them in any way start to say they'll start to kind of panic for a minute like it's getting too warm, just simply move the ultrasound. And once it gets off that area, as quick as a snap of the finger, it won't feel too warm anymore. Now sometimes people have a tendency to race when they do the ultrasound. You don't want to do that. What I would rather do, I'm going to start that over because I just waved to someone. What I would rather have you do is to do a circular motion like I'm doing here, and I'm going to come up closer to the film so that you can see on my arm. I would do about this speed in performing the ultrasound, and if I was going to be doing a circular motion, I would be doing the circular motion at about this speed too. Not a quick speed, not a going back and forth type speed, because we don't want to make them nervous on it. You want to split it if it's bilateral on right and left sides, then do it for a part of the time on one side, switch the spine, do part of the time on the other side, switch the spine, and probably you'll want to do it about 20 seconds on each side, and then go over to the next one, do about 20 seconds or so, and then switch back and forth like that. Remember that the more bony an area is, the more you're going to have to spread out your treatment on that, not staying on one spot, because it will have a tendency to burn more quickly. If it is a thicker spot, then it's going to have less of a tendency to do that, and you can go a little bit slower and stay on an area for a longer period of time. Those are the things I wanted to go over on the ultrasound. Remember, when you do this up in the suboccipital region, you'll need to get their neck in a position that you're able to get up into the occipital region. And to do that, you'll want to position them in a way that will allow you comfortably to do that. Sometimes you may have to double a pillow under their chest or put a single pillow over the chest so it flexes the head forward, and that will allow you more of an opportunity to do it. Also, if you're going to be doing it along the trap ridges, try not to click over the shoulder blades or else it can get uncomfortable for the patient if you're going back over that spot. Those are the main things I wanted to mention. Are there any things you think I should mention further, Leah?
No.
Okay? All right. On HVG, when we're doing that, we're going to use 4 pads. And when we do the 4 pads, sometimes the question comes up, how much water do we spray on? I'm going to come up close to the screen and show that as we do this, we'll want to spray on an amount that's going to give you a good central area so then you can spread it and it'll be wet. Because by the time you get it on the patient, it'll tend to be dry. So hopefully that gives you an idea. I'll spray that once more. About a spray like that, probably 2 sprays. Even if some drops on the floor, it's okay. And that'll give you an amount to start with. Now, when you do the HVG pads, sometimes patients will feel like it's cold, which it is cold. One way that you can help that, especially if your hand has been wet anyway, is to put your hand on it for a minute and then put it on. I'm going to show Leah on her arm a difference of that, just so she can get the experience of it. First, I'm going to spray this one and just put it on like that. You'll feel the cold from that. Then I just sprayed it, put my hand on it, and then put it on. Did you feel the difference? It's a very simple thing, but it'll take away, and yet for her it felt just as wet, it'll take away the shock factor. So I would suggest you do that on people. It just takes a moment, but there's such little water on there that your hand will warm it up very quickly. When you do the electric pads, the thing that's important to remember is good contact and good moisture make good results. Bad contact and not enough moisture make bad results. So when you do the HVG on a patient, you want to make sure that you place it in a position, for example on the gluteal area, that you're going to get enough contact, and also on the spine that you're going to get enough contact. The way that you do that is either having them on their back, or secondly, by having them on their stomach, and you put the pads covered with a hot pack or covered with the weights. Okay, the weights that can be used are like this. You have to make sure that if you put them on, that they still don't leave the rim up too much. And so my tendency is to let it go over the edge like this, and then take the other weight and put it over the top one, and let it be over the edge. So between 2 weights, you're able to keep them flat. If you try to do it with just 1 weight, you'll get the center doing it okay, but on the edges it'll be tilted up. If you use a hot pack, the same thing will apply, that you've got to make sure it covers enough to keep that flat on the buttocks. The same thing is true when you lay the patient on the side. In laying them on their side, and I'm going to demonstrate that for a moment. Let me take these off you here. Them on their side, you'll want to have them double the pillow so it fills in the gap from the neck to the shoulder. Like that. And then okay, we're going to start that over. Go ahead and sit up. First of all, before you have them lay down, you want to make sure that you're prepared. And the way that you'll be prepared is if you need 1 strap, you'll have 1 strap down. If you're going to need 2 straps, have them laying down so that you don't have the patient getting up and down so much. So on Leah, we're going to use 2 straps. We'll have the pillow, the open end, away from her because it'll be more comfortable for her. And we're going to slide this strap down then like this. This strap I had positioned a little bit off. And that would be about the strap positioning that I would use for her HVG for her low back. In this particular case, we're going to put some electric current on her low back at L4S1, and we're also going to put it on her right and left buttocks from the side because that's usually a harder application. I just want to go over that. So I'm going to take the 4 pads. Because I have her scrubs still on, I'm not going to wet these. The first thing you'll want to do is to make sure that you have untangled these so that you know which channel the HVG pads are with. Otherwise you won't know which pads are in which places so that you can use or have control of the machine for those. Now my tendency is that I think it works better to work one side and another side. Combine one side for one channel and another side for the other channel, because they'll generally have one side that is more sore than another. And if you cross them, then they're going to feel in one spot more than another on a much more frequent basis, and we can't balance it as well. So I'm going to start with the lower one. We would have this pad under her buttocks and have her come back against that. We would have this pad in the low back area at the L4S1 region. Okay? Then what we'll do is take the second pad, put it adjacent to that for the L4S1 region, and the final pad we'll put on the buttocks here. When you go to put the hot pack on, as you do it, you're going to have to keep the 3 pads tight, meaning that the bottom pad that's under the buttocks is going to be held tight because of the strap. The upper pad buttocks, or the upper buttocks and the pad on it will not be tight. So I'll bring this over, strap this down like that. Then I've still got 2 pads that are positioned decently. I'm going to bring the other pad around and use the hot pack to keep those tight. I'll bring this around, and then as I firm it up, I want to make sure that the pads are still positioned right, and then I'm going to tighten it down on her so that it holds them in position up against her. Now that shouldn't be, is that uncomfortable on you?
No.
It should just feel firm. Now she's ready for the electric current to be put on. I'm going to talk to you about the HVG machine for just a moment and some of the settings. There are some different modes that are on the HVG machine, and I want to explain them to you so that you'll know what they are. Okay, there's a bandwidth that is used, and the bandwidth has a narrow, medium, and wide. Generally speaking, that will indicate how, for lack of a better word, piercing the electric current is. I tend to prefer the wide bandwidth. I think it's more comfortable for the patient. Then there's another that's called, that's the pulse width, by the way. Then there's another one that's called mode. Mode is the setting for it. It can either be continuous current to both channels all the time, or it can be a surging current that goes from a light current to a large one and then back off again, or there can be a reciprocating current which switches from one channel to another. I prefer that you use a wide pulse width, and I prefer that you use the reciprocal setting, and unless we change that for some reason. And so as I do this now with Leah, we can make those assumptions that it'll be on a wide pulse width and it will be on a reciprocal setting. And as I turn that on, then I will tell the patient that now I'm going to turn on the electric current. I want you to tell me when you first feel any prickle. Now of course you're not going to feel it because I have your scrubs on, but with the patient said I begin to feel a tingle feeling, then I would say, okay, I want you to feel, or tell me when you start to feel it tighten like this. And just so that you'll know, I take their hand or their forearm and I squeeze it about the way that you would squeeze a loaf of bread. If you could squeeze a loaf of bread and not have it squish the bread and be indented, but you could just do it and it would bounce back, that's about how hard I would want to squeeze their arm. I would then say, I'm going to turn this up, tell me when you feel it tighten like that. They would tell you, well, I think I'm feeling that. Okay, that's fine. Now we're going to go to the other one. I would turn it on, and I would do the exact same thing. Have them tell me when it starts to tighten like that, and it's set. Now, a couple of questions they may ask you. The first one might be, well, I don't feel it equal on both parts. That's normal. Right now you have some injured tissues that are going to have different nerve sensitivity. We want to set it to the minimal one on that side so that it doesn't hurt you. And when as you get better, you'll see that you'll be able to tolerate more of it. The second thing that they may ask is, well, I don't really know how high to have it go. And sometimes the therapist will say, well, tell me when that feels right. Well, the patient doesn't know what feels right. You're going to tell them what feels right. And the way you do that is what I just said. Tell me when you start to feel a tingle. And then when they tell you that, then you'll take their leg or their arm or something, squeeze it lightly like you would a loaf of bread. Tell me when you start to feel it tighten like that. They'll tell you that. Now then, when you're done setting up the therapy, then you will give them the nurse call button and say, I expect things to be fine, but if for any reason something starts to hurt, you feel uncomfortable in the position you're laying, or if this timer goes off, then please get me. The timer will go off when you hear a bell ding. We will have a timer set, but just in case it got missed, make sure you push the nurse call button. And I would give that to them. When you take this off, the first thing you'll want to do is turn the channels off, and then you'll undo the therapy belt. You'll take the hot pack off, and we'll take the pads off. Make sure that, again, you do a good job of separating them so they don't tangle up quite so bad. It'll make it easier for the next time you come in to do the therapy, and then you'll set them on here. What I would like to not do is not set the hot packs on top of the machines. And the reason for that is because the humidity or moisture that comes from that will tend to wreck the electronics of the machine.